an established interventional radiologist. For all of you who don't know, Professor Ho-Young Song is the inventor of GI metallic stents in the form that we see them today. He has been awarded all the possible scientific.
Doctor, please open your camera. Please open your camera. Doctor, please open your camera. And I can hear you. Can you please open? Yeah, great. I hear you well. You will be live after.
Yeah, I can hear you.
You will be live now.
Yes, it's okay. شكرا دكتور هاني شياب على المقدمة الكريمة. مساء الخير السيدات والسادة. أود أن أشكر دكتور هاني شياب لأواتي في هذا يشرفني وجودي هنا. Today, I'd like to talk about the role of drug-eluting stent in benign esophageal strictures. First, let's briefly go over our take-home messages regarding the expandable metallic stent in benign esophageal strictures. Bare metallic stent placement in patients with benign esophageal strictures is a relative contraindication because its long-term results are poor. I'd like to show you two examples here. In this patient with bare metallic stent placement, because of benign esophageal strictures, here you can see stricture after placement of tantalum bare stent above and within the stent 2 months after stent placement. In this patient with the bare G stent for corrosive esophageal stricture, you can see again severe stricture above and within the stent 4 months after stent placement. Placement of covered stent and biodegradable stent is safe and useful, but with a high recurrence rate. Tissue hyperplasia represents a major limitation to long-term stent placement. I'd like to introduce our experience with the drug-eluting stent in rabbit. To overcome the problem of tissue hyperplasia related with the stent placement in benign esophageal strictures, we developed IN1233, an ALK5 inhibitor eluting polyurethane covered stent. Our previous study has shown that activation of TGF-beta signaling pathway is implicated in production and remodeling of the extracellular matrix and the proliferation of epithelial cells and fibroblasts that leads to stent restenosis. ALK5 is the TGF-beta receptor that phosphorylates SMAD3 and triggers many cellular processes which are involved in tissue hyperplasia. In 2013, we evaluated the effectiveness of an IN1233 eluting polyurethane stent in a rabbit esophageal model. We used a polyurethane covered stent for control. Both stents were 12 millimeters in diameter and 20 millimeters long. We divided 40 rabbits into 4 groups. C4 and C8 received the polyurethane covered stent, which is a control stent, and D4 and D8 drug-eluting stent. Animals in C4 and D4 were sacrificed 4 weeks after stent placement, and those in C8 and D8 8 weeks after stent placement. Here you can see the big difference between C4 and D4. You can see tissue hyperplasia above and below the stent, exactly like the patient with benign esophageal strictures. And the percent of tissue hyperplasia induced by the stent on esophagographic findings was significantly less in drug stent than in control stent. Histologically, again, here you can see big difference between C4 and D4. The aggregation tissue area and the number of epithelial layers and thickness of submucosal fibrosis was significantly less in D4 than in C4. I'd like to move on to stents with a per-oral ALK5 inhibitor and MMP9 siRNA in rats. In 2017, we evaluated the effectiveness of EW7197, which is a per-oral ALK5 inhibitor, in suppressing tissue hyperplasia in a rat esophageal model. We placed a bare nitinol stent, 5 millimeters in diameter and 15 millimeters long, in 60 male rats, and we divide the rats into 4 groups. Group A received 0.3 milliliters of artificial gastric fluid by gavage once daily for 4 weeks. Group B received a solution of drug dissolved in the artificial gastric fluid for 4 weeks. To evaluate the rebound effect of the drug, 2 more groups were added for this study. Group C received a solution of drug for 4 weeks, followed by artificial gastric fluid for remaining 4 weeks. And Group D received a solution of drug for 8 weeks. Animals in groups A and B were sacrificed 4 weeks after stent placement, and those in groups C and D 8 weeks after stent placement. This slide shows the flow diagram showing the randomization process and follow-up. A total of 11 rats were excluded from data analysis because of deaths in 2 rats and stent migration in 9 rats. Histological study was performed in all groups, and additionally, Western blot analysis were performed in Group A and Group B. The luminal diameter, or in Group A, this is A and BCD, was significantly smaller than those in groups B, C, D. You can see also difference on fluoroscopic image. This is Group A, B, C, D. But there was no significant difference among B, C, D. Histologically, here you can see smaller thickness of submucosal fibrosis and connective tissue area in Group B than in Group A. Regarding the Western blot analysis, you can see less expression levels of p-SMAD3 and cadherin, fibronectin, and alpha SMA and TGF-beta in Group B than in Group A. I'd like to briefly talk about siRNA therapy in a rat esophageal model. MMP9 is a key factor responsible for the pathogenesis of restenosis by controlling extracellular matrix degradation. This is a surgical specimen obtained 3 weeks after dual stent placement for sigmoid colon cancer. Here you can see severe tissue hyperplasia at the bare part of the dual stent. As a target for siRNA, we choose MMP9, because the overexpression of MMP9 was closely associated with the stent-induced tissue hyperplasia in patients with colorectal cancer and with esophageal cancer. Based on this information, we hypothesized that MMP9 siRNA therapy could prevent tissue hyperplasia. In 2014, we evaluated the efficacy of RNA interference therapy using siRNA targeting MMP9 to prevent tissue hyperplasia in a rat esophageal model. A total of 30 rats were used for this study, and a bare nitinol stent, 5 millimeters in diameter and 15 millimeters long, was used for this study. The rats were divided into 3 groups. The ESO-N group, control group, did not receive either stent insertion or medication. ESO-S group underwent stent insertion only, and the ESO-R group underwent stent insertion and medication. Here you can see a stent placed in the lower thoracic esophagus in a rat, and the 2 balloons, one above the stent, the other below the stent, filled with the contrast medium. In the ESO-R group, we introduced the drugs into the stented esophageal lumen using a micro double balloon catheter for 30 minutes, 1 week, 2 weeks after stent placement. All animals were sacrificed 4 weeks after stent placement. Again, here you can see big difference between ESO-R group and ESO-S group. The papillary projection thickness and granulation tissue area and percent of granulation tissue area was significantly less in ESO-R group than those in ESO-S group. The zymography and immunohistochemistry staining and Western blotting and the real-time RT-PCR showed reduction in MMP9 expression in the ESO-R group than in ESO-S group. In conclusion, selective ALK5 inhibitor eluting stent per oral ALK5 inhibitor and siRNA therapy have therapeutic potential in the prevention of tissue hyperplasia secondary to stent placement in the esophagus. شكرا جزيلا لإنصاتكم. I cannot hear you.
Can you hear us, Dr. Song?
Yes, I can hear you.
Yes.
Thank you.
So yes, it is 4 a.m. now in Korea?
Yes, 4:55.
Well, I can't thank you enough for being up that early to be present with us, but really it was a very eye-opening presentation.
Thank you very
Are there
much.
any questions from the floor or from the chairpersons? Well, I have one question. These molecules, they seem to be very promising.
Yes.
Are there any concerns about their compatibility to humans? I mean, possible side effects? Do you expect that they will cause serious side effects or no?
Yeah, that's a good question. It's on clinical trial. Actually, that drug is an anti-cancer drug, but it has function of prevention of tissue hyperplasia. So I'd like to use that drug for benign strictures. So we have a long way to go, but anyway, the drug is promising, and then on clinical trial.
Okay, and there were many studies from China doing something similar on using radioactive beads in the stents to prevent also tumor ingrowth. Do you have an experience with that? Because they have actually experience in humans.
Yeah, I know. Dr. Teng Gaozheng is my friend. He developed radioactive stent, but it has some limitation because when it migrated into the stomach, it can damage the stomach wall. So personally, I'd like to use retrievable stent because we can remove the stent anytime. And also drug eluting stent is safe than radiation. That is a good question. But anyway, it is popular among Chinese doctors.
Okay, I think we will conclude. Thank you very much, Professor Song. Thank you, everyone. It's been really a fascinating presentation. Thank you to our chairman, colleague, Professor Steer, Professor Mustafa. Thank you to the audience, and wish you all a very pleasant night, and wish you a pleasant day, Professor Song. Thank you again, and thank you, everyone. Have a good night. Thanks.
Shukran.